is harvested fat, and this is before we centrifuged it and obtained the stem cells and the growth factors. This is just simply harvested from the patient. You see the fat column here, and there's some fluid that we'll get off, which is the numbing agent, saline, salt water, and also has the epinephrine, which helps to cut down bleeding. This is a special syringe that has been manufactured for the lipotron, and it basically has a filtration system that allows the lysed fat cells, the old fat cells that turn into oil, they'll go through the special filter, and when we spin this, it'll be right at the cap on the syringe when we finish. We'll decant the fluid, and we'll have the oil at the top decant, and we'll have a perfect fat graft. And the stem cells will be right at the bottom in the growth factor at the little buffy layer coat. We'll show that to you after we spin the centrifuge. This is fat that's been harvested after lasering with the Zirconia medical laser. This laser creates a small pore in the membrane of the fat cell, and these fat cells have been lysed, and there's an oily component that is on the surface of the fat harvested syringe here, as you can see. The cells are distorted. This only lasts about 30 minutes, and that's when we harvest this fat to discard. This fat is not used for transplantation, but this is just a demonstration to show what this fat looks like after the first laser is performed. As you can see, we've got the spun fat in a 60 cc syringe with a special filter. The filter allows the removal of the oil, which are the older fat cells that have been lysed during the aspiration process and the spinning process. The golden column in the center is the fat graft, and the premature or stem cells, precursor cells, are down here at the bottom, the top few millimeters, and the white buffy layer in between there is basically where the growth factors are as well. We're going to decant the fluid off the bottom, and we're going to remove the oil off the top. These do not help the take rate, and inject this in. The stem cells will give us a more dramatic effect and long-lasting effect when we translocate them. They act like fat when they're placed into the subcutaneous fat. They behave like muscle when placed into the muscle, and they act as though they were a bony tissue when placed over the periosteum or the layer over the bone. So it's a pluripotent cell at this point. It's amazing how this transformation occurs. The other thing that the growth factors will do is create collagenesis, which is new growth of collagen in the skin and soft tissue. The patients tell us they feel like they have a glow in their skin afterwards.
In my heart and in my mind, I stalled at 30 and never came out of it. And my spirit was still fresh and energetic and young, but I looked in the mirror every morning and saw a woman who was every bit of 60. And the conflict just got way too distressing for me. So I came to Dr. Lyons, and he did an overwhelming job of giving me exactly what I want.